Welcome to the Cardiovascular Pulse, where we dive into medical breakthroughs, leading technology, and healthy lifestyles. Join us as we empower you on your journey to a healthier and stronger you.
Hi listeners, have you ever felt pain, cramps, or tiredness in the legs that have improved with rest? Well, those can be early warning signs of peripheral artery disease, also known as PAD. Today I'm here with Dr. Pradeep Nair, Interventional Cardiologist in Houma, Gray, and Zachary, Louisiana, to discuss PAD with us. Thank you for being here with us today, Dr. Nair.
Thank you, Skylar. Great to be with you.
Awesome. Now first, I guess we'll dive into what is peripheral artery disease.
Yeah. So PAD in layman's terms is essentially a blockage in a blood vessel of the leg that reduces the blood flow to your muscles, bones, or tissues. And there's a wide variety of blockages. It could just be cholesterol layering in the arteries that's not obstructing any blood flow, to a blockage that's causing leg pain when you're walking, all the way to severe blockage where you start to develop tissue loss or ulcers on the leg.
Absolutely. And what causes this?
It's the same thing that cardiovascular disease specialists deal with all the time. We deal with blood vessel disease, and it's called atherosclerosis. That's the name of the condition where cholesterol builds up in the blood vessels. And essentially what we see in the legs is the same thing we're seeing in the heart or in the brain, in the carotid arteries, where cholesterol starts to layer into the wall of the blood vessel. That can happen from a variety of risk factors. And then over time, if unchecked, those symptoms can progress to a point where the patients can have severe disabling symptoms.
And what are some of the symptoms that a lot of people face? I know that a lot of times it can go undetected, undiagnosed, some of the time.
Yeah. So, if you look at the statistics, roughly 25 million Americans suffer from PAD. That's the statistics. And, not all of them have clinical symptoms, like where they're having leg pain or ulcers on their leg.
Right.
But knowing that you have PAD and understanding that the presence of PAD is there is a way for the doctor and the patient to now address potentially other serious problems in the body. When you have PAD, it's a marker of having coronary artery disease. And so we have to start thinking about preventative measures to try to help the patient and keep them from developing their symptoms moving forward. So the symptoms, while in the initial phase are really masked, and you don't have are subclinical, we call it. They're not having major pain. The symptoms of PAD, you may just start to notice some hair loss on the shins. Those are one of the early signs that something could be going on in the leg. Some patients can get vague symptoms like numbness in the leg or burning in the legs. That can sometimes mask other symptoms like neuropathy. Peripheral neuropathy is another a symptom that masquerades as PAD, but sometimes they go hand in hand. And then the typical classic symptoms, which we hope we can avoid, is that the patient's walking and then they end up with what they call Charlie horses in their calves or in their thighs, pain when they walk, where they have to stop walking to relieve that pain.
Right.
That is a sign of decreased circulation. It's another term for it in the medical terms, claudication, and that's where you have decreased circulation, and that's one of the earlier clinical signs that we want to be aware of so that we can address that and help prevent progression clearly to the latter stages, which we term critical limb ischemia, which is a major health concern. So that's what you're typically looking for.
And when should a person go to see a cardiologist if they think that they might have PAD or they're feeling something, or maybe not?
Yeah, I would say that if you have a family history of heart disease or any vascular disease, getting checked early in life just for a screening test, even if it's just a blood test, is a great idea. You may have a mother or father had a heart attack, or they've been on cholesterol medicines for many years since they were young. Just get checked out. There's simple things. It's not a procedure. It's just a blood test. Typical things that we can do to screen for cardiovascular disease. So I would take those patients who have risk factors. Diabetes, if you're a diabetic, definitely get checked out earlier so that we can work on prevention to prevent the disease from happening down the road.
Right.
And the other things that are kind of self-explanatory is smoking. If you are a smoker, we hope you're not a smoker, but if you are a smoker, these are significant risk factors for developing not just peripheral artery disease, but cardiovascular disease, including aneurysms in the aorta.
Yeah, which is definitely very important. Now, preventative measures. Is there a way to prevent PAD through lifestyle modifications or other prevention methods?
Yeah, I think we're getting better in prevention. If you look at the history of it, we've been dealing with preventative care since the 70s, at least, even before that. Medicines have really come to fruition, dealing with cholesterol, lowering the cholesterol, specifically the LDL cholesterol, the bad cholesterol. We work on that. That'll help prevent progression of atherosclerosis, helps reduce some inflammation in the blood vessel. There's things called antiplatelet medicines that help to reduce occlusions in these vessels. Aspirin, for example, is just a simple one that we talk about. Blood pressure control, we can work on all of these things together. Lifestyle modification is probably the number one thing. Forget the doctor, it's all about the patient. The patient can take the control in their, take charge in their own lifestyle by monitoring what they eat, a moderated diet, trying to avoid high content of fatty, saturated fats in their diet. Those things can help. Monitoring if you have diabetes or at risk of diabetes, monitoring what you're taking in from a sugar load. I think diabetes is probably the number one risk factor associated with cardiovascular disease. Yes. So if we can control that, that'll be helpful to the patient. And exercising. Even if you have clinical peripheral artery disease and you're able to exercise, like you have pain, the Charlie horse in the leg, I recommend that those patients exercise. You may have pain, walk a little X amount of distance, you have pain, stop, rest. Keep doing that amount of distance, and then over time you'll start to notice that you can maybe go from point A to point B. Maybe after a couple of weeks, by just doing that walk, you can go from point A to point B and now to point C. So you're walking a little bit further. It helps recruit new blood vessels called collateral circulation, which is very important in the healing process, is recruitment of new blood vessels in a process that is called angiogenesis, which is the formation of new blood vessels.
Wow. So really exercising can help more than I thought.
Really help.
It really helps. And
but it's extremely helpful, but the problem is you need your legs to be able to exercise. So think about this.
Yeah.
If you have an ulcer on the leg and you let it go, and now you end up with a major amputation, major problems. You're not exercising anymore. And in fact, if you have a major amputation in the leg, we're talking about a below or above the knee amputation, the statistics say and show over many, many years that your risk of dying or mortality is 40% to 50% in 2 years. So we want to avoid major amputation in patients. This is one of the main reasons why we are so aggressive in trying to treat our patients in the earlier stages so they don't have to suffer the consequences of the latter stages.
Yes, and so preventative care is key here. And the diagnosis of PAD, it's pretty simple, right? It's just, what's in the diagnosis of PAD?
Well, it starts with the patients come in. I mean, if they do truly have a leg symptom, the simplest test is an ankle brachial index. ABIs, that's the short term for ankle brachial index, is a measure of pressures differential from the arm into the leg. And essentially, it's just a number. You get a quick number. We do screening at CIS, periodic screenings for ABI testing to help patients understand the risk. But ABIs are very important. If you have an ABI between 0.9 and 1, it's a normal ABI. That's good. If the ABI is extremely high, that means that your blood vessels are calcified or hardened. It's called hardening in the arteries or calcification in the arteries. So it's not very accurate. But what we know from statistics and epidemiology studies is that the lower your ABI, the higher your mortality or risk of dying. There's a associated risk with lower ABI, which is a sign marker of obstruction in the peripheral vasculature in the lower extremities of the leg. The lower your ABI, the higher the risk of mortality, dying. So if you have an ABI less than 0.4, Okay, that's we term that critical limb ischemia.
Right.
Your risk of dying is higher than all cancers except for lung cancer. So your risk of dying is exceedingly high. And so obviously we don't want that, right?
Oh, yeah.
So we want to prevent. So if you're in the subclinical stages, I just talked to you about exercise, diet, watching the cholesterol, blood pressure, diabetes, and not smoking, we can help have our best chance of preventing you from going from this normal, ABI all the way down to a low ABI 0.4, which is what we absolutely want to avoid.
Yes, absolutely. And it's good to know that there's some things that we can control in helping ourselves with this. And of course, preventative care is important, getting diagnosed, going in for screenings, and we offer free ones at the clinics. And so can you tell me a little bit about treatments for PAD or procedures and what they're like, what patients can expect or people can expect?
So, I think, my career specifically has been really heavily focused on treatment on patients, because a lot of the referral patients that I get, unfortunately, have a lot of those disease processes that we talked about that are now beyond the preventative stage. I like to see the preventative patients, because then we have a chance to prevent us for having to do a procedure down the road. But when we have to do a procedure, just want to let the patients know that we are extremely skilled and are up to date on the latest technologies that we can utilize to treat our patients. We're involved in multiple national, international clinical trials in treating patients with peripheral artery disease. We serve as investigators or principal investigators in multiple trials, where our practice is very well known, starting with our founder, Craig Walker, based on his years of experience, and actually who trained me now almost 11 years ago, to being experts in the field. And we pride ourselves on being experts in the field. And these treatments that we offer are ways in which we can unblock the blood vessel simply through a catheter that we can place in the artery to open up the blood vessel. And there's multiple ways we can do it.
Right.
We have multiple modalities. That's a technical question, but at the end of the day, in layman's terms and simplistic terms, we are able to look inside of your blood vessel. We're able to determine with an ultrasound, which is an imaging tool, to see what kind of blockage do you have. Is it a clot, which is soft and mushy? Is it scarring, which is more like a fibrotic scar tissue? Or is it all calcium hardening in the arteries? And we have various tools which we can decide which is best for this specific lesion to try to unblock it. We have ways to treat it with modalities called lithoplasty or intravascular lithoplasty, which is where patients have heard of kidney stones being treated with lithotripsy. We can do that in the calcified vessels in an artery to help open up the blockages.
Right.
We have tools called atherectomy that can help get rid of that plaque inside of the blood vessel. We have lasers. That's something that we are very experienced and are experts in utilizing. We have a variety of balloons that can open up the blockage. We have a variety of stents that can open up blockages. But at the end of the day, I think if you are coming to CIS, I can assure you that you're going to be with the best. That I can assure you. We're very skilled in treating a lot of complex blockages, but most important, let's try not to get there. Let's stick with the preventative side and see if we can keep patients from needing the procedure in the first place.
Stick with the preventative side, and being proactive is very important. And also, I noticed that everything is tailored to each person's
individualized. Every patient is different. We can't use a cookie cutter method for every patient. A lot of, not just physical, biological differences, but a lot of patients have, social differences. And what I mean by that is, being able to come to the appointments. Who's the family member that can drive the patient to the office for the appointment? I can't stress enough that when we're dealing with that critical limb ischemia phase, it is so vitally important for our patients to take it seriously, because it is a serious problem. And we can help you, but we need to see you in the office. And sometimes it's a little bit, seems like a lot of appointments, but it's a long process. It's a challenging process for these patients. A lot of suffering involved, but we're here to help. But the only best way we can help our patients, especially with critical limb ischemia, is that they come, follow up with appointments, and we really need to recruit the help of their families and neighbors to help those who are having challenges getting to our office to be able to get to our office. So that's one thing I have to stress to our patient population.
Yes, absolutely. That's a big factor. And also, like we were talking about earlier, preventative care is very important. We want to see you before it gets really bad to the worst stages it can be. And so what necessarily happens if it's undiagnosed? I know amputations play a factor.
Yeah.
Are there any other things that can really play a factor into that?
Yeah, I mean, if it's undiagnosed, I mean, sadly, we see a lot of patients who are undiagnosed. I think, we never give up. We never give up. We're going to fight the fight with our patients. We can't save every leg, but we're going to try damn hard to try saving it, and it's a two-way street. We need to work with our patients. But, when patients start to notice anything on their leg, even if they have any question, if they think it's silly, I mean, we're here for you. Yeah. We can just check it out and say, okay, it's nothing to worry about. Yes. If you have any symptoms in your legs, you're not sure what they are, there's no harm in just getting checked out, or go to one of our screenings, and we can at least take a look and see what's going on.
Yeah, like you said, a lot of things happen in the legs, and a lot of people chalk it up to, aging, or, I was just walking a lot today. Maybe I'm just in some pain. And a lot of different signals that your legs are trying to tell you could be something more serious. And even if you think not so, as Dr. Nair is saying, just come by and stop and see us, and we can just check it out and make sure all is good before it gets to those stages where they'll still save. They'll fight to the nail, but we don't want to get you there. But everything was great. Thank you so much for being on the show with us.
Dr. Walker says to us all the time. I gotta quote Dr. Walker. He always says that sick legs are never attached to healthy people.
Right.
So remember that. Like if you have a problem in your legs, it could be like you mentioned, Skylar. It could be an issue in the heart, in the carotids, in the brain, or anywhere else in the vascular system, but we're always here to help you.
Absolutely. Thank you so much for sharing all your insights today. I appreciate you being on the show.
Oh, thanks, Skylar. Appreciate it.
Thank you.
We hope that this has empowered you on your health journey. If you have health concerns, visit cardio.com to learn more or request an appointment. Make sure to follow this podcast as well as CIS on social media for updates. Thanks for listening.